Okay, coming to the main important complications in the during the antenatal. So this and also postnatal. So first one is the pregnancy-induced pathology. So because of the pregnancy, the mother may chance to get the diastasis recti. So diastasis recti means nothing but if you see these abdominal muscles are the rectus abdominis muscles. You can see all the abdominal muscles. So is a transverse abdominis. So that means from the vertically move from the sternum to the pubis. So you can see if the growth is increasing, so these abdominal muscles are going to be separated. Normally, these two bellies, this is transverse abdominis and also right and left. So these are going to be joined with the linea alba. So because of the fetus growth, so this is going to be increasing the separations. So this is the without the diastasis, there is no separation of the abdominal muscles. Coming to the, if you see here, the separation around the umbilicus, and here the separation below the umbilicus, this above the umbilicus, and also the rest along the full length of the linea alba. Linea alba is nothing but the line between these is a two muscles. These are two muscles are going to join with the linea alba. So because of the weakness of these abdominal muscles, so these muscles are going to be separated. So these muscles, if they separated, so they feel the more discomfort, more weakness. They're unable to maintain the posture is naturally. So how we can give the significance about the diastasis recti. So that means, so ask them to lie on the supine lying position. So ask them lift the head forward and also lift it head and also shoulder elevation. So if they keep the two fingers below the umbilicus and also above the umbilicus, if they feel any separation of the muscles, so it is the significant separation of the diastasis recti. So this diastasis recti may occur in the pregnancy as a result of the hormonal effect on the connective tissue and also biomechanical change in the pregnancy because of the posture, because of the hormonal changes. So they may chance to get this diastasis recti. So and also during the labor, so with the prolonged holding of the like a breath holding, so also may chance to produce the diastasis recti. So it can occur, just now discussed, the surrounding to the umbilicus, below the umbilicus, above the umbilicus, or is completely along with the linea alba. So these things, so we can ask if you want to check who are having the muscle weakness or muscle separations, so we can do in these positions, ask them to do the supine lying positions. So if we keep the two fingers is a horizontally, so we can get the separations. So it indicates gives the clear significance of the diastasis recti. So how we can avoid the diastasis recti? So if we give the proper precautionary exercises, so before the delivery, so if we give some strengthening exercise to the obliquous muscles and some strengthening to the abdominal muscles, so we are going to prevent these diastasis recti. So if we check the supine lying positions or the hook lying positions, nothing but is the bending the knees and also hips together, 90-90 pose. If we keep the three fingers, so if it is more than two fingers, it indicates the significance of the weakness of the diastasis recti muscles. So how we are going to manage the diastasis recti? So how we are going to teach the exercises? So especially teach the patient to perform the corrective exercise for the diastasis recti, exclusive of the other abdominal exercise until the separation is decreased, that is until the less than 2 centimeters. So we have to give the exercises, especially the surrounding to these abdominal muscles, those muscles are called as the obliquous muscles. So if we give the strengthening to the obliquous muscles, that is internal oblique and external oblique, so we are going to prevent this diastasis recti, the weakness in the rectus abdominis. The rationale for this that due to the angle of attachments of the obliques into the linea alba, so there is a possibility that is trunk rotation exercise will appropriate the separations. So that means if we strengthen these obliquous muscles, so we can prevent the separation of this linea alba. So how we are going to strengthen these exercises, I'm going to show the further slides, next slides. So main important So we should not concentrate on the abdominal muscles because the fetus growing time. So we should not encourage the abdominal muscles because of the fetus may discomfort and also mother also feeling the discomfort if we give any abdominal exercises. So instead of abdominal exercise, we have to concentrate on the core muscle exercises. Especially these are oblique muscles. I'm going to show what are the best exercise to prevent the diastasis recti in the next slides.